All right, moving on, we're going to talk about the appendicular skeleton, which is the outside of the skeleton, right? So it talks about the arms, the legs, and the structures that hold them in place, the pectoral girdle and the pelvic girdle. All right, so looking at this picture here, the pectoral girdle is your shoulders. And then that supports the upper limbs, which is the arm here, the forearm, the wrist, and the hand on both sides. The pelvic girdle, which are the hips, support and maintain the lower limbs, which is the thigh, the leg, the ankle, and the foot. So when you look at the pectoral girdle, it's really 4 bones, 2 on each side, 2 clavicles, 2 scapula, supporting and forming the shoulder, which moves down into the upper limb. So the upper limb, the upper arm and the forearm, 6 bones, the humerus in the arm and the radius and ulna in the forearm, radius being on the lateral aspect of the arm, ulna being on the medial aspect of the arm as you view the body in anatomic position. And then moving down to the far more intricate wrist and hand, which is 54 bones total, 16 carpal bones, 10 metacarpals, forming the palm of the hand. The carpals are the wrists, the metacarpals form the palm of the hand, and then the phalanges are the fingers. So you have 10 proximal phalanges, 8 intermediate phalanges, and 10 distal phalanges. And I'll challenge you to figure out which fingers don't have intermediate phalanges. That should be a test question. All right. So then moving down to the pelvic girdle, which is the pelvis or the hips, you look at the 2 hip bones on either side. If you really want to get into detail, the hip bone is comprised of other bones that fuse together as you age. So it's a little more intricate than just the hip bone itself. The lower limb comprised of the thigh and the leg, right? So the thigh is made up of the femur, which moves down to the patella over top of the articular surface of the tibia and the fibula as it moves down into the foot and ankle. Now the foot and ankle also intricate as well as the hand, right? It does a lot more things, a lot more intricate fine movements. 52 bones total, 14 tarsals or 14 ankle bones, 10 metatarsals that form the forefoot, 10 proximal phalanges, 8 intermediate phalanges again, and 10 distal phalanges. And those are the toes, of course, right? So that is the basics of the skeleton. Now, I encourage you and highly recommend that you go through some of these resources. So the first 2 websites here have some interactive diagrams. You can really zoom in and look at some of the smaller bones and their articular surfaces. You can zoom out and get a bigger picture of where everything falls, how the body moves based on where those bones are placed. If you want a really good diagram that's labeled, has some anterior and posterior views of the skeleton, this Encyclopedia Britannica link here is awesome. It's a really good picture. And then lastly, there's a YouTube video down here at the bottom. It's very detailed. It gets into the minutia of bone being a living connective tissue, but it really talks about the cells, how bone is formed, how we're constantly building and breaking down bone in a state of homeostasis for our body. Very, very cool. Got some really cool hand drawings in there. So that's all I have. I hope you guys enjoyed this class. I think you're going to find it really useful when you do your medical terminology coming up, when you have your physical therapy lessons coming up. So, and if you see me in passing, I might ask you a question or two. All right, you guys stay safe, and I hope to see you soon.